Question, the member from Windsor West.
Thank you, Speaker. My question is to the Premier. For months, hospitals in Windsor have been bursting at the seams. Patients who already face long wait times are waiting even longer. Some are even being admitted without a bed. Hospitals are forced to choose between performing a surgery and admitting a patient. The state of healthcare in Windsor has truly reached a tipping point. Will the Premier admit that years of chronic underfunding and frozen budgets have put families at risk?
Health and long-term care.
Premier, Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And perhaps I can begin by thanking our hospital workers, our nurses, our physicians, all of those that work in the hospital, because it has been a difficult flu season, Mr. Speaker, that there have been a number of capacity issues because the outbreak of flu this winter season was worse than it was last year. Fortunately, of course, the flu vaccine was an almost exact match to the flu that we have seen, but that did bring some specific and time-limited problems and challenges to our hospitals, including, if the member opposite has listened to the leadership, the hospital leadership themselves, that they will attribute a lot of what they saw due to the flu outbreak itself, including in the Windsor region. But, Mr. Speaker, it's important that Ontarians understand not only do the vast majority of the more than 150 hospitals in the province exist far below that 100% capacity, but the investments that we're making are making a fundamental difference in terms of them addressing those challenges.
Thank you. Supplementary.
Thank you, Speaker. I actually called the Minister's office about the crisis with the outbreak of the flu at our hospitals, and what I was told is tough luck. The cupboard's bare. The doctors and nurses that you just applauded will just have to make do. It's the same answer we got when over 150 nurses, registered nurses in Windsor, received pink slips. Again.
Tough luck. The member from Beaches East York is warned. I had a choice. Finish, please.
Thank you, Speaker. Again to the Premier. Hospitals should be equipped to deal with an influx of patients during flu season, yet this government's chronic underfunding leaves hospitals and healthcare workers scrambling to fill the gaps. Emergency department wait times in Ontario have reached their highest point in 9 years. In Windsor, at least 20 surgeries have been cancelled because hospitals simply do not have enough resources. Will the Premier finally admit that her government has let patients down and commit to providing enough funding to allow our hospitals to meet the needs of our community?
Well, thank you, Mr. Speaker. And again, and I don't want to attribute everything to the flu, but it's important to understand that for Windsor hospitals, as of December 31st of 2016, the Windsor Hospital, the Metro site, was 84% capacity. Maryvale site, is that correct? It says Mary Valley here. It was at 68%, and the Willette site was at 94%, Mr. Speaker. So the 3% increase in hospital funding that we announced as part of last year's budget and last fall, that nearly $500 million makes a big difference. What doesn't make a difference is if we follow what the NDP did by closing 24% of all the acute hospitals in the province and 13% of the mental health beds. And I know every single one well of my 25 staff, and they would never respond. And everybody in this legislature knows they would never respond to an inquiry like that, Mr. Speaker.
Thank you.